Hi, this is Patricia Scott with Hypnosis Institute, and I'm about to do an interview with Dr. Robert Churney from Clearwater, Florida, and he is a periodontist that did surgery on me a while back with no anesthesia, using only hypnosis for the entire oral surgery that I had with him, including some bone grafts. So this is an interview with him that he agreed to do very graciously, and we will talk to him in just a moment. Hello.
Good evening.
How are you doing?
Just fine, just fine. How about you?
I'm doing great. You have a long day's work today?
Yeah. I think it was a full moon, but I'm not sure.
Oh, I don't know. I usually write it in my book. I like those full moons. You can usually tell, though.
Yeah.
It is St. Patty's Day, so if there is a full moon, it's going to be a wild night for some people tonight.
Oh, gosh, you're probably right about that.
So I was looking up some information on you, and the one thing I couldn't find was my paperwork on when I had that surgery.
It was August 17th, 2017.
Wow.
And then January 15th, 2018.
What was the 8 and 18?
Those are when we took out those two teeth. The
Okay.
main surgery was August 17th, 2017.
Wow, I didn't realize it had been that long.
We're old.
I keep saying, it was a year and a half, 2 years ago, maybe, right? But basically, is it considered oral surgery? Is that what you would call it? That's what I've been calling it.
Periodontal surgery.
Periodontal surgery.
Yep.
Okay. So what I'm going to ask you, and again, I looked up some things about you because I didn't know that much about your background. I knew that you were a periodontist. You have Churney Periodontal in Clearwater, Florida. Yes.
Correct. Yes.
And I saw that you've been in practice for over 30 years.
I have.
Yeah.
In this area, I came here in 1987. Before that, I was a general dentist from 1983 through 85 in Louisville, Kentucky.
Louisville. I saw that, and I lived in Louisville briefly many years ago.
Yeah, cool.
And you're also, I understand, the president of the Florida Association of Periodontists.
I am now past president, maybe 4 years, maybe 5 years. I was the president of the Florida Association of Perio. I was also the president for the West Coast Dental Association of Florida, a board of trustees member for the Florida Dental Association, and a board of trustees member for the American Academy of Periodontology, representing the Southern United States, District 3.
Wow, I really came to the right guy, didn't I?
I saw that
you also have been in on a lot of firsts and onlys, I noticed on reading your bio.
Yes, I'm the first periodontist in the West Coast of Florida that have the perioscope, which is the dental endoscope that we use here in the office. I guess I am somewhat of a early adopter on some technologies if I feel they are correct.
Very nice, very nice. Well, I'm really even more impressed than I already was with you. And I actually am in my 29th year as a professional medical hypnotherapist and hypnotic anesthesiologist. The anesthesiologist part I've frankly mostly used on myself. I've helped a few other people with pre-surgery things and things like that, but never completely without anesthesia. Nor would I try to talk someone into that, obviously. But it is a skill set that I learned early on when I first started hypnotherapy 29 years ago. And I believe in practicing, walk the walk, talk the talk, that kind of thing. And since I'm a trainer now of medical hypnotherapy, I put a program together several years ago that is now approved through the International Medical and Dental Hypnotherapy Association. And I teach it every year at their conference. And then I do another training on my own here in Florida. In Palm Harbor area, which now is online the last 2 years because of COVID. But it's turning out, the interesting thing I'm noticing is all of the techniques, even with pain relief, I'm doing processes with people, demonstrations online and with clients too. And it still works, which I have to admit 2 or 3 years ago, I was thinking certain things you got to be in the room with the person. But I have to admit, I'm a believer now that it truly is inside of the person. We're just guiding them. That's what I tell my students all the time.
Well, I'm a true believer after treating you. As you said, when you first came in and sat down in my chair, you said, this is what I'm planning to do. If this is going to be a problem, I can go elsewhere. And I said, I'm willing to give it a shot. And it was amazing. That's the easiest way I can describe it. I was so nervous going into your procedure, thinking that you were going to feel something, and you did not move. You were, the only time you moved was that when you started getting very cold, because we keep it cold in here, and I thought you were feeling something. You said, nope, I need
my
a
lips
blanket.
were quivering. I could feel that. They were just quivering because I don't like being cold.
And I said,
I
oh my
hadn't
goodness, are you
prepared for
feeling
that.
Yeah, and it's like, are you feeling anything? It's like, no, I'm cold. Give me a blanket. And that was it. You never felt
Another blanket.
there was no bleeding. There was nothing. There was nothing.
And
It
I
was
have
amazing.
told, oh, I love hearing that. And I have told this story many times. Now we always wonder because we experience the world from our own frame, you know, and that's
Sure.
part of what I teach. We know that in general, but it really is true that our memories sometimes are not accurate if you ask the other person that was in the room with you. So I've
Right.
told this story so many times. The things that stood out to me, the things I remember the most, is you. Well, by the way, I'd like to have another copy of that letter you wrote to my to the dentist that referred me to you,
Okay.
because I somehow have, I don't know what happened to it. I can't find it in my database.
I'll make it
But you
happen.
had, yeah, the last thing I remember you saying after we were finished, before you abruptly left the room, was, I have to go check my blood pressure. And I thought, oh, isn't he? Because I know you're kind of funny. You got a sense of humor. And I thought he's joking, right? And I looked at the girl that was there, your assistant, and I said, was he serious? She said, I think so. And then I saw the letter you wrote. So
I was convinced. I mean, I was ready. I had a syringe there. I had anesthetic there.
yes.
I was ready that if you felt anything, I was ready. You did not feel anything. We never had to take the cap off the anesthetic. Nothing.
And I
Nothing.
love you saying all those things. I'm going to clarify one point, but the
Sure.
main thing when somebody's doing anything, because they've done open heart surgery,
Right. We talked about that.
hypnosis, yeah. And anything you do with hypnosis, you want to make sure you've got that available. It's
Yeah.
got to be available. I went through a procedure earlier. It wasn't a real intense thing, but a few years ago in California, earlier in my career, and they had the injection site ready if
Mhm.
they needed to inject the anesthesia and all of that.
Sure.
That is an absolute. And when I teach medical hypnotherapy, even when I teach my regular hypnosis students, because you're going to end up working with things that are still going to affect the rest. And the other point that I wanted to talk about is that I didn't feel anything. I love that from your frame of seeing it, it appeared that way. The interesting thing is, there were a few times when I was challenged with the cold.
Mhm.
It made it a little more challenging for me. It made me a better hypnotist. I tell all my students this, because I had to work harder at it than I had been in past procedures.
Sure.
Plus, it was a little bit more intense thing than I'd done before. But it made me better at what I do, because it would bring me back into consciousness because of the cold. And the other part of it was it made it a little bit more challenging to do the deep breathing that keeps you relaxed. When you breathe deeply, it sends signals to the brain that you're safe. And that allows the chemicals, the feel-good chemicals that, all those big long words that I can read them, but I probably don't pronounce them all right. But all those chemicals that are naturally in the body that are pain relievers, they're natural pain relievers, to a point that takes you there. And if you're breathing calmly and deeply, your body signals to the brain, oh, you're safe. Go ahead and release those feel-good chemicals. Where, of course, the opposite of that is when you get scared or you get anxious, all of a sudden you get constricted, it gets harder to breathe, and different chemicals are released that make it more challenging. So part of it was, yes, I did have times during that surgery when I felt something. Now, I'm not gonna frame it as pain. I'm gonna frame it as I was uncomfortable a few times. Sure. But it made me work harder, and I had to, on the spot, come up with some different ways of thinking that allowed me to get through it. And I loved that it happened. If you asked me afterwards, I'd say it was the best thing that could have happened, the cold, because it forced me on the spot not to just, be nonchalant. I had to be actively more involved with it. So it made me a better hypnotist. The other thing I wanted to mention, I love that you said on your own, because I was going to ask you about this, about the bleeding. You said
that's exactly what I was just going to say. I was just going to comment on that. If we cut ourselves normally, there is going to be some bleeding there. You had prepared your body so much that when I made my incision, there was absolutely no hemorrhaging, none. And so
you hadn't told me that before.
There was no hemorrhaging. I mean, it was just like, okay, I'm It's like when we give anesthetic and we give a local infiltration, part of it is a vasoconstrictor to stop it from bleeding while we're doing our procedure. It was like I had given you a dose of that. There was no bleeding. It was amazing to see.
That's so interesting. And one of the reasons I was going to bring that up is because I think I mentioned the first periodontist I was referred to. I did an interview with him and he said, I couldn't use hypnosis. And I said, why? And he said, because, and it kind of makes sense why from his frame he would say that now from what you just said. He said, because the anesthesia helps to control the bleeding. Now, see, I thought that was BS. Right away, my brain just ejected that. And he said he wouldn't do it. And so I, as I tell my students, I fired him, after the interview. And I told my dentist, I said, I'm not going to go to him. I want to go to someone that let me. And my memory of our interview that I tell my students is that when I told you I was going to use hypnosis instead of anesthesia, that you got excited.
Yep.
I said,
because I'll try it. I'll try it because if I have the anesthetic there, I can always give it to you quick enough.
That's right.
So let's give it a shot. I'm willing to try it. If someone is a believer, I'm willing.
So the part about the bleeding, I love seeing that because that wasn't in the letter either. And the fact that I think that's an important thing for me to have on this video for other dentists to listen to. Because I work with a lot of hypnotists that work with hypnotic dentistry or hypnodontics, they call it, those kind of things. And they call it HypnoSedation is a new word they're using now for the anesthesia using hypnosis.
It's perfect. It's actually a perfect way to describe it.
And I didn't see that until just the last few months when I was doing some more research, which I do constantly for my classes. But HypnoSedation, I thought, what a perfect word for it. So the medical journals are using that term now, the medical journals. So it is getting more common. It's not as big of a sales force out there for it like there are for the chemicals that are being sold, but it is getting known. The other thing I was going to ask you about is the amount of time that the surgery did and my recovery, those kind of things.
Well, the surgery was what I'll call a normal course of surgery here in our office. It was around 2.5 hours. Yeah. So it wasn't an extensive, maybe, we scheduled 3 hours, but I think we went around 2.5 hours for the length. Post-operatively, it was, you took no pain medication, which I still remember being shocked when you came back in a week later because we had done bone
I didn't
graft.
fill the prescription.
You didn't fill it, and it's like, and I still remember my assistant coming on the corner for the first week when you came in and said, "You got to look at the tissue. It looks like it's healthy as anything." And I mean, it had healed so fast, so fast.
Nice. And again, I'm a believer in using everything available. When I teach my medical, I'm very careful about scope of practice, teaching, the laws and the scope of practice and the respect for being on the team, part of a team. And having said that, I think there is a place for using the power of what the mind can do in order to assist people going through procedures.
Absolutely. I mean, I'll break it down to the easiest way. If even my patients that are not going to do hypnosis or anything like that, I explain to them that when I talk to them about their case, they have to believe in what I'm going to do, or I can tell you it's not going to be successful. They have to be on the team with me. So they're not even hypnotists, just being there in the thought pattern that, yes, we're on the same team. Otherwise, it's not going to work. It's not going to work.
And see, and when I teach hypnosis, I'd love to have you in on some of my classes because the idea of hypnosis is not about, I'm going to take, 20 minutes or a half hour to put you into hypnosis. That's not what it's about because we hypnotize ourselves all the time when we take in information and form an opinion about it and start playing that belief system. That to a large extent controls the outcome and the experience we have going through something. So you literally, in my opinion, you are giving post-hypnotic suggestions. We call them prestige suggestions, meaning they trust you and respect you. You have a place of stature in their mind that you know what you're talking about. They trust you. And so when you say something like that to them, they take it in and it goes in other words, it bypasses that critical faculty and it goes into, so in a way you could say it is a form of waking hypnosis, we call it.
That's interesting.
Because we are influenced by what we hear and what we allow to come into our belief system and the representations that we make in our mind based on what's being said and what's being presented to us, which is why when I work with pain relief, we talk about pain at the beginning of the of the session, because that's what everybody calls it, and they know, so we know what we're doing.
Sure.
And very quickly I start to reframe everything and start talking about, instead of the pain scale at the beginning, it very quickly becomes the comfort scale.
Sure.
And all of the focus and all of the attention is on the comfort end, because where your attention goes, that's where the chemicals in the body start to match up to whatever you're focused on. And if you're focused on pain, even most the doctors I work with, they all know if you think about pain, you can make it worse really quick.
Absolutely.
And
I mean, in your case, when I started the procedure, if you remember, the first thing I asked you is, well, let me know when you're ready. And you said, well, I'm ready now. And I was like, wait a minute, you're talking to me. I had this picture of hypnosis of being out like a trance. And you're like, no, I'm ready now. And it's like, well, okay. That was shocking to me.
It's one of the misconceptions, because it's about focusing. Hypnosis is really just focusing. When we talk about people in sports, once you've done all the training and you're ready to compete or play, you get into what they call the zone, meaning you're in the moment now. You're not thinking about what do I do next, or what do I do if this happens, or what did I just do? If you are thinking about that, you're not playing very well. Gotcha. So it's about in that moment now, what can I focus on now? And in athletes, they learn what to focus on in the moment that can allow their natural abilities to flow without that tension and stress, or inhibiting themselves with negative thinking, that kind of thing.
Sure.
So with HypnoSedation, the idea is, in this moment, what can I think of that will allow me to feel the best?
Absolutely.
And if something else comes in that you can't, it's not about ignoring. I always tell people, it's not you're going to put rose-colored glasses on like back in the 60s, right?
Mm-hmm.
And the world is all rosy and everything's fine. No, what's happening is still happening. It actually makes you more aware of that. And it allows you to be in control of what can I think of to be at my best and most comfortable getting through it, moving through it.
Gotcha. Very interesting.
So it's about focusing the mind and intention and practice. I practice a lot.
Yeah.
After the session with you, like I said, it made me better, and I'll prepare for even more things now. But one of the things I was always told is that hypnosis helps with controlling, to some extent, controlling bleeding in medical procedures.
It does.
Yeah.
I'm here to tell you, I watched it. I saw it.
Yeah. And within a year or two of first training in the hypnotic anesthesia and that kind of thing, I had my full hysterectomy, and I had just learned all this stuff, and I started working on it, and I had been told, and I trusted, and I let it in as a belief system, because I heard it from enough people that had used it. And I said, I gave myself those suggestions, and I practiced for the week or so before. And I said, there's going to be little or no bleeding, only as much bleeding as is necessary, those kind of things. And I just over and over and over, trusting. And I would go to sleep at night thinking those things. I think I even had a cassette tape back in those days that I was listening to. And because, I'd never done anything like that myself. And when I went in and had the surgery, the doctor came in after, and my husband was there, and the first words out of her mouth was, there was very little bleeding. And it made me so happy. So my belief system got strong really fast because I did it for myself.
Yeah.
So
very cool.
And again, if nothing else, then to relieve some of the anxiety of people coming for even simple dental procedures. I know some people are terrified.
Absolutely. There's a number of phobics out there, a number of phobics. You're right.
Yeah. And it's easy to train in alternate, I call it pivotal response conditioning. It's where you interrupt patterns and send it in a different direction. It starts to create new neural pathways. So that then when the person comes in after practicing a little bit, it starts to automate after some point. And you can still, like I had to do in the surgery with you, you can still also take charge in the moment and send it in that direction intentionally. But after a while, it starts to become your natural way of thinking, that those patterns are interrupted, and say, well, when I think of it this way, it feels better. Right. And sometimes that's the best you can do, is just feel better,
Sure.
So I just want to tell you, I respect you so much. I talk about you all the time in my class.
Thank you. Thank you so much.
I just so appreciate you taking your valuable time, because I know you work long hours and work hard.
Hey, but, I'm glad to do it.
You also like the beach and golfing and things. I saw that in your bio. So.
Yes.
Right.
Yeah, but I wanted to do this for you. You made a believer out of me.